Good afternoon. It is wonderful to be here with all of you. It is wonderful to stand with this really august group over here. I can't thank you all enough. Thank you for coming, Kip and Martha and Vicki, who taught me how to be a state representative many years ago. And thank you to the press who's cared enough to come out here, to be here, and learn about what we can do to become a more resilient Missouri. COVID-19 is serious business. We've got to take it more seriously than we have in the past. So let's start with where we are. This state and district has become what is known as a hot zone. Republican politicians in Jefferson City have been unable to adequately address the pandemic and its consequences, preferring to stick their heads in the sand, to wait for the crisis to pass, while Missourians struggle to keep their heads above water, pay their bills, and keep their families healthy. Some families, small business owners, and independent producers will struggle to recover their losses over the years. Others are having to endure the pain of losing a loved one or suffering long-term health consequences of infection themselves, known as the long haulers, which we haven't even talked about. It did not have to be this way. Instead of proactively facing this crisis, Missouri's GOP leadership delayed action early in the pandemic and squandered precious time and opportunity. They now continue to be without a plan to address the critical needs of mid-Missourians. Even the White House has raised an alarm about the rising number of cases in Missouri, with 1,800 Missourians now having lost their lives. A COVID-19 hotspot in Boone County, public schools unable to return in-person classes, and businesses closing their doors. We must take urgent action to manage the dire consequences of this crisis. We must also lay the foundation for rebuilding our communities over the months and years ahead. The pandemic has exposed many economic, racial, and public health disparities across our state. We need to prevent a resurgence of COVID-19 and apply the lessons of this pandemic to the future. We could even begin to repair our tattered safety net in Missouri. Our Democratic gubernatorial nominee, Nicole Galloway, has crafted a strong plan for executive leadership, and we must do the necessary first steps in her plan. But we also need legislative action. Rhetoric and short-term Band-Aid solutions are not enough. While the federal government has provided support to states, the support does not make up for the losses Missourians have shouldered. And as we hear from Kip Kendrick, it's not even showing up at all. We call on U.S. Representative Vicki Hartzler and Senators Roy Blunt and Josh Hawley to work on loosening the restrictions on federal CARES Act money and to keep the funding in Missouri and to immediately support a second federal pandemic relief package to help our state. We ask our Republican colleagues here in our own district to do the same. As we wait for further federal relief, however, it's up to our local and state level leaders to put our state on the right path, give our neighbors a chance to breathe and reset, and become a more resilient Missouri. The state legislature should take urgent action, but they are doing nothing. Here's what we can do, and I outline 5 pillars. First, ensure access to treatment and care. I've got more in the plan than I'm going to say today, and we've given it to press. Ensure access to treatment and care. So first, protect the voter-approved Medicaid expansion as number 1. People need access in order to get the care that they need. Unfortunately, that's not even going to happen until July. An emergency action would be absolutely wonderful. Ensure vaccinations and approved treatments related to COVID-19, including drug treatments, are cost-free for patients with no barriers. Extend support to our community health centers and ensure an uninterrupted supply of PPE. I propose that we have our own state stockpile for the future in case this happens again. And we'll do that as state senator. And finally, we need to monitor our health insurance companies and the changes in premiums during and after the crisis, as incomes and profits for top insurance companies has risen by 150% this last quarter during the pandemic, and premiums are predicted to rise by 10% in 2021. Number two, help families remain stable. In other words, suspend the terminations of vital state program benefits, including Medicaid, until after Missouri's unemployment rate has returned to pre-COVID-19 levels. And also waive work requirements for SNAP and TANF. Because when people lose their job, it's really hard then to find work in order to get food and assistance. And also to provide incentives to landlords to forgive or reduce rent owned by tenants during the crisis, allowing people to use the unemployment insurance that they receive to pay their rent and to make their payments. Extend the temporary and transitional child care subsidy benefits as well. Number three, rebuild the economy. Provide unemployment insurance benefits in Missouri that are on par with benefits in other states, neighboring states, no less. And have additional pandemic-related federal assistance and make it a supplement to those federal funds. And with a priority to minority and women-owned Missouri businesses, extend grant loan assistance through community lenders in order that independent farms and small businesses who were left out of the CARES Act funding can thrive. Create a system of voluntary state-sponsored retirement accounts. This is a really exciting one where people can start to save for their future and build an economy that works for them and that they can have a nest egg. 4, lift up our vulnerable neighbors. Extend and expand the nonprofit relief and recovery grant program beyond its initial $2 million statewide budget. $22 million given for the nonprofit sector to respond to the pandemic is not near enough. Even just in Boone County, 1 year is approximately $250 million go through the nonprofit sector. So $22 million statewide is nothing. And we all know that our nonprofit service organizations have really stepped up to feed and clothe and get school supplies for people, just everyday needs. So I would create a system where we support them better. And then lastly, like we said earlier, protect democracy. I would like to create, as senators, a bipartisan recovery caucus where we get together, we don't argue, we find solutions. We identify the problem, identify what our solutions might be, and then decide together how we move Missouri forward and really do it. And also, I think we also defend clean Missouri. Vote no on 3. And that way we will get the representation that we deserve and that we need at this time. I also think we ought to protect the authority of our municipalities and counties to pass local regulations to ensure public health and safety. The bottom line is we need a comprehensive plan that accelerates testing, contact tracing, contains the spread of the disease, and then a set of public policies, like I've laid out, that address the needs and security of our community. I'm ready to do that as your state senator. I'm here with a plan, and my opponent is golfing at this very moment. There's a stark difference. It's a very big contrast between me and my opponent. While he golfs, I'm putting in a plan that will guide us to the future. Thank you very much, and thank you for coming today. We will open for questions.
I've got a couple of questions. Do you have an estimate of the costs to state government for the things that you're asking for that would have to be borne by taxpayers, such as additional unemployment or longer unemployment benefits, or some of these programs for the state to sponsor retirement accounts?
So for the benefit of another audience, the question is, do we have an estimate of what the cost would be for some of these things? We do have a plan for working on paying for them. That would include so that we could bring money back to this community. It is also very difficult to put a price tag on these things. I'm a big proponent of the cost-benefit analysis, so even though, I would like to sit down with my other senators next year and talk about if we do a robust safety net for our community, what could we save? What would be our savings? We learned that with Medicaid expansion. Medicaid expansion has a cost, and our Republican colleagues want to talk about cost without talking about benefits. So I want to sit down and talk about what we could find in the budget to go pay for this and what the benefits would be.
And you mentioned that your opponent is playing golf. He has. How would you rate his personal response to the pandemic and the way that the state Senate has responded?
I would just say, I would start with where has he been? Where has he been on leading and modeling the behavior that we need? Masking, social distancing, getting out there and encouraging others to do the same. I've seen absolutely nothing to indicate that there is that this is even a priority in the senator's eyes. And while we wait, see, we could have done all of this earlier. My grandmother said it, an ounce of prevention is worth a pound of cure. If we could have prevented where we are today, we could be back to our schools. We could be back to a more normal lifestyle that we had. Other countries have done it, but instead, I think that my opponent and the Republican leadership has followed the leadership out of Washington to downplay what is going on. And that has caused us to be well behind the curve where we could have been had we followed the recommendations early on.